Welcome to the third part of the SC Biz News live stream power event on reopening the region for business. My name is Alexandria Ng, Digital Assistant Editor for SC Biz News. We're the publishers of the Charleston Regional Business Journal, Columbia Regional Business Report, GSA Business Report, and SC Biz Magazine, a statewide development magazine. From the Charleston Business Journal, we also publish the Market Facts Guide, the companion publication to the Book of Lists, packed with a wealth of data and statistics about the Charleston region. This year, Market Facts will include the latest data on the impact of COVID-19 and how it has reshaped the economic outlook and drive of the region's economy. Advertise in Market Facts and position your company as a valuable resource. We're so glad you have joined us this morning as we use technology to keep you safely informed with expert advice and insight from the region's business leaders. Events like this are only possible with support from our sponsors. We're going to hear from some of these companies and organizations right now. If you are in need of a product or service, please consider these companies.
Good morning. My name is Gabrielle Poole, and I serve as the Founding Program Director for the Charleston Southern University Physician Assistant Program. CSU is proud to sponsor Part 3 of the Charleston Regional Business Journal's Reopening the Region for Business Today. Like many of you, CSU is eager to return to a sense of normalcy as soon as it is safe to do so, and I look forward to hearing from our panelists today about the ways our community is responding to the coronavirus pandemic. I serve as a member of the university's Pandemic Task Force, and we are working hard to create policies and procedures that will allow us to bring our faculty, staff, and students back to campus in the fall semester in a way that promotes the health of our community while mitigating risk. Charleston Southern University works hard to align our academic programs with the needs of the community. As the program director for our physician assistant program, I am blessed to be able to lead the efforts in training competent and compassionate medical providers who will be part of the response in meeting the need of our community in the future. Thank you again for the opportunity to sponsor today's event.
For doctors, getting information quickly can help save lives. So having the most reliable network really matters. Verizon lets them monitor patients at home and use real-time video to consult with colleagues. Keeping patients healthy is what drives doctors. Being their partner drives us.
All right, thank you, Alex, and thank you to our sponsors and our audience for joining us today. My name is Andy Owens. I'm the executive editor of SC Biz News. And what you're about to see right now is a live event. This is not scripted. It is not pre-recorded. We're in a studio in North Charleston. Just like our in-person events, which we've had to change to remain safe, these work best when the audience participates. And there are two ways that you can do that. The first is by going to your YouTube chat window and putting in a question. We have a producer, Brian Wilcox, who's our creative director, who will be going through your questions and putting them up on a screen for us to field. The second way is to have a discussion in that chat window among the other audience members about some of the topics that we're talking about today. Back in 2016, MUSC Health, Roper, St. Francis Healthcare, and Trident United Way completed a collaborative project to look at the region's healthcare called the Tri-County Community Health Needs Assessment. From there, the project launched Healthy Tri-County, which is a multi-sector regional initiative designed to improve health in our Tri-County region, Berkeley, Charleston, and Dorchester counties. The idea was to positively impact the health outcomes of every person in every community in the region. In 2019, the partners reconvened and expanded their data collection efforts to engage the community and shareholders more expansively. And then everything changed. Coronavirus has become the lens through which we see our lives personally and professionally. It's also the lens through which we can view some of the data that was gathered by the group. In the short term, we're all wondering, when can we get back to work? When can we get back to school? But in the long term, this could be an opportunity to look at some of the data outcomes that we've been exploring for years, and that's what we're going to talk about today. So in the studio, I have Mark Dickson, Vice President of Mission of Roper St. Francis. Mark, welcome. Yes, thank you. And Renee Linyard-Gary, the Director of Health at Trident United Way and leader for the Healthy Tri-County Initiative. Renee. And by video feed, we have Anton Gunn, who's the Executive Director of Community Health Innovation and Chief Diversity Officer for MUSC Health. Anton, thanks for joining us.
Thank you.
All right, I'm going to start off with a question for everybody to kind of get us warmed up. The coronavirus pandemic has been a shared experience for the entire community. How has each of your organizations navigated this disruption? And I'd like to start with you, Anton, if I could.
Mm-hmm. Yeah, so thank you again for this opportunity this morning to be able to talk about these important topics. The coronavirus has unprecedentedly shifted how we operate as an organization at MUSC Health. As the state's healthcare system, if you will, we had to respond in a different way than probably just the average local organization. The legislature tasked us with a particular task just about a month ago to set up and test statewide across South Carolina, from everything from pre-COVID screenings to antibody testings. And so to date, I think we've tested more than 30,000 people across the state, doing about 800 a day per site. And we have 10 sites operating roughly at the same time. So we did not anticipate this. Of course, everybody knows about the challenge around personal protective equipment for our healthcare workers. We had to ramp up very quickly and order lots of PPE in order to be able to keep our healthcare team safe. But I think the biggest disruption is the way patients and consumers see healthcare organizations now. We have data that shows that the average person is no longer wanting to come to the hospital for things that they would normally come for. So for instance, you're in your backyard, you stumble over a rock and you sprain your ankle, or you twist your knee and you have a major injury and you don't know how to manage it at that point. People are not coming to the emergency room because of the fear of getting the coronavirus or being exposed to it, even though your healthcare entities are probably one of the safest and most responsible places you could go at this time. So we're having to spend more investment in time and energy around educating around the right things of how you should still continue to come to the hospital, and also how do we keep people at home and safe, and particularly for our underserved populations, which I know we're going to talk about more into the program. It is very difficult in this current circumstance. And so we've had to shift a lot of things. Our whole business model is now evolving. We have brought things into a virtual environment that we never thought we'd bring into a virtual environment. But now we're seeing that this is something that actually is working. So long term, it could shift how we do business, no different than how it's shifting every business to think about what they do differently.
All right. Second healthcare organization, Mark.
Yes, thank you. On behalf of Roper St. Francis Healthcare, some of the same issues Anton just described is how we have adjusted, but keeping our system strong, safe, and open, that we are able to take care of the whole range of services that we provide, from prenatal care to cancer treatments to surgeries, all the things that really we've had a couple months now to work on this. And so to be able to keep the system going, and have the emergency extra plans for whatever might be coming now with the surge happening now. And so we just continue to do what we can, being strong and safe. And yes, as Anton said, it's a matter of trust in the community that we do have. And things like telehealth has really risen, I think 80%. So some of the things that we've talked about and dabbled with now really zoomed up, like telehealth, though, and that'll be more of a permanent thing. Once people started that, they started saying, wow, this is easy and good to use. So there's been a lot of positive feedback on that. But I've had some physicians kind of caution that, wait a minute, we still want to see patients face to face. We need to touch them to maybe diagnose and catch cancer, or we got to look people in the eye better to maybe see something we wouldn't see on a video screen. So we still want to have that in-person care as best as we can. So again, encouraging people to keep coming in. We are safe and doing all the right things that way. The big adjustment, too, has just been what everyone's been struggling with in the community of the distancing and not touching each other. We like to hug. We like to be involved with each other. And so this is isolation has really had probably some more mental health issues that are occurring.
Absolutely.
As some are saying, we're going to have a collective post-traumatic stress going on around the country in that regard, too. But that's enough for
What about the United Way, Renee?
Yeah, at Trident United Way, you know, our main focus is on education, financial stability, and health. And so we've reacted on all fronts, you know, with that trust that Mark talked about in the community, as that community convener and facilitator of many of the conversations, but also in that communication channel about what our health systems, through our Healthy Tri-County initiative, what our health systems are seeing and what the needs are that they're talking about in the community, but also hearing back from the community through their needs with use of programs like our SC 211. You know, at first, at the start of the pandemic, when the call volumes went up exponentially about the need for basic needs, Trident United Way responded. And that first response was with the COVID response fund. And through that fund was focused on the basic needs, also providing emergency networks to develop, if need be, to respond to those basic needs that we're seeing in the community, as well as, you know, just making sure that our nonprofit partners in the community that are many times addressing the needs, the health needs, not only in the healthcare systems, but also in the social service sectors, are able to still operate and be responsive in the community. That was a big factor. So being able to have that coordination and communication through the Trident United Way, through our health arm, and being responsive and making that pivot immediately and gathering and galvanizing the community to come together and be responsive. I think about in the basic needs space, when we talk about at the top of the pandemic, we saw a need for food access, food insecurity. And so I always like to give the example of the event that we had out in Dorchester County at our Dorchester Resource Connection Center. It was the first time we had to pivot and offer a mobile drive-through food drive. And that event, 375 families came out.
Wow.
That means feeding over 1,500 people. That's phenomenal. I mean, that's the immediate response. And in our community, through the Healthy Tri-County, we look through a lens of health equity and social determinant. And some of those social determinant factors start at home and in the environments that our community live, play, and work. And so when a family has to think about now, unemployment was a major issue as well.
Sure.
That money that I have for maybe putting gas in my car, I'm going to have to think about the toss-up between putting gas in my car and feeding my family. And so any way that we can respond and help make those choices and responses more fluid and flexible for families, that was our immediate response as a Trident United Way, partnering with our health partners and going forward to make sure that our community is taken care of from the health end of it, but also for economic stability. Those were the two biggest shifts, I think, at the top of the pandemic.
Okay. All right. To kind of frame up the meat of our discussion here, before we continue, I want to cue up a data clip, which will touch on some of the topics in the health landscape report for 2019. All right, very good. So looking at the data, in every county, access to health care ranked as number one or a number one or number two concern. What does that mean specifically? And I'll just open it up to whomever wants to take it.
I'll start.
Okay.
You know, access to healthcare is the number one and number two priority because access is just not the traditional things that we think about. We think about having health coverage as the immediate access to care, but not thinking about, well, I have the health coverage, but do I even have the transportation to get to services?
Right.
And so a big part of that access to care element that you see is that people have other factors that are barriers to them getting into care. A big part of it is not knowing what resources are available to them. Is there quality health clinics and facilities in their area? When we think about our rural counties of the Tri-County, the access points, some of those individuals are 20 plus miles out from the nearest health clinic. So access starts the conversation. Access can mean things of medication. Do I have my medication? Do I have transportation? Do I have all the things I need to be healthy and to also, go along with the plan of care that even if I do get into a provider, do I have all the things there to help me be healthy and well? And so those social determinant factors under access to care, it could be broad. And like I said, it's multifaceted, multi-approach to access.
So it can be the literal access, getting transportation to a doctor.
Yes. And the value of what a even bus pass can be to someone
Right.
who even lives in the metropolitan central areas, getting down the road, just even down Rivers Avenue where our Trident 908 office is, from point A to point B, just a bus pass and the access that they have there and building that into the population for them to get to services.
And let me add, Renee is speaking to the real scope and scale of what we say access problems. Just use this example. You could have a person who, because of education, because of opportunity, has to work 2 part-time jobs in order to make enough full-time money to take care of a family. However, their shift doesn't allow them enough time to leave from one job to go home and take care of the kids before they get to the second job, but yet they have to get to the pharmacy to pick up a prescription. But in the zip code or the community that they're in, all of the pharmacies close at 7 or 8 o'clock, or at least the pharmacy portion of the store closes at 8 o'clock. So if they're not accessible until 9 or 10, maybe 11 o'clock at night, you might have a prescription prescribed to you by your doctor, but you can't even get access to pick it up to maintain that medical regimen. Or if, for example, you live somewhere in the rural part of Charleston County, say Alwyndaw, or on the other end, Ravenel, and you need to get to a healthcare facility, well, it's 19 miles to the nearest healthcare facility. And if you don't have reliable transportation, how do you get down Highway 17 to be able to get to that doctor's appointment? And sometimes in some communities, there is not enough public transportation. So CARTA doesn't go everywhere people that it needs to go. And so you're relying on friends, family, and hopefully that you can get to what you need. So access is a real challenge. And I also want to underscore, in addition to these things like transportation and even the hours when a pharmacy is open, not having adequate, affordable health insurance coverage is still a predicament for a lot of our residents in our community. Our state chose to not expand Medicaid under the Affordable Care Act. And here we are literally 6 or 7 years still into the ACA. And we have some of the highest uninsured rates in the country in terms of states across the board. So the fact that we haven't given the opportunity for our lower income residents, people who need access to insurance coverage, the opportunity to just have coverage, even in emergency situations, it's going to be more difficult for them to be able to access a physician, a PA, or a nurse practitioner when they don't have health insurance coverage.
Well, I know, Anton, you were on President Obama's administration, and you were known as Mr. Healthcare. What do you think needs to happen at the government level at this point? Is this a state issue or is it a federal issue?
It's a state, 100% a state issue. So I'll put it to you in this context. COVID-19 has exposed a lot more of what many of us, particularly Renee, Mark, and I have been working most of our lives on, is that we have a fragmented and broken healthcare system in a lot of ways. And so we have to be responsive as a state to the needs of our citizens. And so having health insurance coverage is one component. It is not everything. Again, where we have facilities, who gets to build facilities. So if you think about things like certificate of need policy and who's allowed to put a hospital or healthcare enterprise somewhere is an important thing that we have to have a comprehensive plan on. But the point around Medicaid coverage, the state right now, through the legislature, can pass legislation and make the expansion of Medicaid a reality. However, the governor's office would have to implement that policy, and they would have to want to implement that policy and to do it the right way. Another context of this would be is even in our private insurance market, we have a lot of people who are self-employed, are entrepreneurs. They have a small business with 2 or 3 employees. And so they're trying to buy affordable coverage for their 2 or 3 employees, but it's not necessarily affordable the way that we want it to be. And that would require the Department of Insurance to actually take a more aggressive approach to saying to private insurers, we need you to create plans that's affordable, that have good, strong networks. So Roper and St. Francis are in your health insurance network. And so you can choose which healthcare entity you want to go to, rather than saying to people who may, for instance, live in Charleston County, they can buy a health insurance plan, but the nearest hospital that's in network is Prisma Health in Columbia. So how does that help you if you buy a plan and you live in Charleston County, but the hospital that's in network is Prisma in Columbia or Prisma in Greenville, and not the 2 healthcare entities that are within, an 8 to 15 mile drive of your home? So these are all state policy solutions that would be helpful to improve access. But again, some of these things, even if we fix those 2 major hurdles, it's about people being able to get down the road and know where providers are and know how to find them and access them in ways so they can get the care that they need for themselves and their families.
Mark?
Very glad we're jumping into the policy issues that need to be changed and improved for us. But in the meantime, I also wanted to point out to our business community and everyone about a program called Access Health for the uninsured. It's one of the greatest things I've seen in my career. Renee actually developed that over the recent years to take care of people who are uninsured or underinsured, get them into a doctor's office. And another example is Roper St. Francis Healthcare. We opened our new hospital in Berkeley County just this past October. Berkeley's the largest landmass county in the state.
That's right.
And to have a hospital there, it was busy from day one, over 100 patients per day coming into the emergency room.
Wow.
Many uninsured, still take care of them thanks to Access Health. Many people had not seen a doctor in years. Pregnant women who had not had prenatal care. So again, getting people in to get the care they need as early as possible, preventive care, of course. So that was just another example of the need that's out there and getting that access.
And if I can add to that.
Sure.
So talking about, having the health coverage, to Anton's point, to Mark's point about having programs where our community and philanthropy is trying to address these concerns of access to care. That's what Access Health was incubated through Trident United Way. But that is a part of community navigation. The navigation, we talk about navigating for COVID in our health systems. That was a way of us helping the community navigate the health resources that were available, and making sure that the individuals that were receiving those services knew all the processes they had to go through to get into a provider office. And if you didn't have the means to get your medication, what are some of the programming in the community? So making those linkages and connections to the community resources was very important and very instrumental in the healthcare access for those underserved populations that Anton mentioned at the start of his answer to your question.
All right, very good. We got a question from the audience. Mark Wright asks, we know that ERs, hospitals have been hardest hit during the pandemic. What about the mental health, behavioral health systems? Are they overwhelmed too, or can patients gain access if need be?
Mental health has always been a high priority need, really a crisis in the country, and it's here and now with the virus. Especially if a patient is identified as positive with the virus. This is what we're trying to figure out right now on a state level and here locally because we have patients sitting in the emergency room with no place to go, no placements for them. So we need then security and other things for it, and then people are sitting in the emergency room. So needing placements. So I would lean into, Anton, actually, if you could get MUSC to open part of their Institute of Psychiatry for COVID patients, and then we could all work together to help that, because that is a crucial immediate need for mental health. Yeah.
All right. So looking at diabetes and obesity, which are two underlying conditions that make surviving COVID-19 very difficult, it's also a major part of the research that we see in these health assessments. Why do we struggle so much with getting a handle on obesity, nutrition, physical activity in the Southeast, not just in the Tri-County?
So when you talk about obesity, obesity leads to many of those chronic conditions that we're talking about that the pandemic has shined the spotlight on. Diabetes, hypertension, some cancers, all are conditions resulting out of obesity. But I will say it goes back to when we talk about some of those social determinant factors of, do we have the public recreation spaces for people that live in rural? Do they have access to physical activity, right? And then the food choices. So the same way that we talk about, transportation, we talk about, do you have access to readily available, nutritious food options? So if you're in what we call a food desert, right, you're living in a community where there is no public, no grocery store there for you to go get healthy, nutritious foods, then how can we expect for you to make that healthy food choice when all your choices have been minimalized? And so that is what you see, I think, a lot of what in the southeastern part of our country, that's some of the issues. There's rural communities, there's limited resources, and the resources that they do have are not helpful in their food choice and selection as an individual or for your families. Anton, any thoughts on the obesity and physical activity? Knowing where you come from in your space as a previous Gamecock football player, any thoughts about what that looks like in the Southeast?
Yeah, so I would say this is a huge challenge for us all around physical activity and obesity. And I think we, for those of us who have a few years on us, and I don't think we have any teenagers in the house, we have to find a way to rebuild the partnerships that allowed us to have our greatest level of physical activity and engagement when, schools worked with communities to allow those playgrounds and those basketball courts and those ball fields to be open on afternoons and weekends so children have a place for themselves to go and play. Right now, the experiences that we have in communities is that some parks have padlocks on them when they close at 5 p.m. I have one in my community that at 5 p.m. they close the gate and keep everybody locked out. And so how do we create spaces that are safe, that allow kids to be active and outside, particularly as we think about the coronavirus? A lot of people have gained 20 pounds, 30 pounds, what they call in the COVID-19, because people have been cooped up in the house. And so physical activity is probably the most important thing. I mean, I've fortunately been able to lose 20 pounds since I've been home because of COVID-19, because I've been working remotely, and that allows me the time during the middle of the day to go exercise, where before I wasn't able to do that. So we got to find a way to rebuild those things. But the nutrition side, I think, is so important. Having access to fresh fruits and vegetables, not having food deserts in our communities, and making sure healthy eating is affordable. And I think it's going to take not just a regional effort, but it's going to take a national effort to look at how what is valuable in a grocery store. My wife, who's a avid health and nutrition person, basically her approach to groceries is to stay out of the center of the grocery store, to stay on the extreme. So walk to the fruit and vegetable side and walk on the other end and get the things that we need, but stay out of the anything that's boxed. And so how do we do that education so people can understand what is healthy eating and how do we make that affordable? These things are desperate for everybody in our community. We have to find a way to address them in the short term as well as the long term.
And if I can add to that,
Yes.
so one of those ways through Healthy Tri-County that we're looking to do just what Anton talked about, we have to figure out how do we address these needs. We have taken the approach under our clinical preventive services to bring the National Diabetes Prevention Program to our community. And that expansion effort is something that we have taken the charge on and built into our health improvement plan. Trident United Way has taken investment to support that expansion. That expansion will happen in our rural communities. There's programs going on right now of national diabetes prevention in Hollywood right now and in Moncks Corner. Those programs have had to pivot as well, going from in-person sessions to doing distance learning. And then with the securing of a accelerator investment in Access Health. We have those patients that are underserved that have many of these chronic illnesses or are about to go from pre-diabetic, have the risk assessment goals there that they have the scoring that they would qualify for the diabetes prevention, and utilizing that effort through Roper St. Francis that houses Access Health to be able to offer that programming. So that's something that's new and recent this month, actually, hiring a diabetes lifestyle coach and a program coordinator to run that program, and so that we can expand and make that a sustainable program throughout our community going forward.
Do you think it's going to change, that COVID-19 is going to change how we talk to our doctors about obesity and nutrition?
Yes, absolutely. I'm looking for the silver linings in some of this as we get through this pandemic. And one of the things is that we've been talking about these issues for years.
Right.
But now, more than ever, if someone is put in a more vulnerable population, it's just this huge wake-up call that we all just need to be healthier, more active, eat more nutritious foods, and get a handle on that for our own sake, because it's a life and death situation if you're in a more vulnerable population that way.
All right. So one of the most shocking stats in the report was the infant mortality rate for African American babies. How do we begin to explain a mortality rate of 11.6 children compared to 2.3 for white children across the region? How do we explain that number?
It goes back to the access topic. Access to care for those individuals, mothers, starting from preconception, their health, their prenatal care, their access to those services, and that starts the conversation. So if you don't have access to get those developmental screenings, to find out early about any disabilities that might be there, you can't make that plan for treatment either. And so getting the necessary immunizations and screenings, all those things matter. But when you talk about for maternal and infant mortality rates and the numbers that you see, is an access issue, but also as a mother, as an African American mother, when you access those services, there are barriers that you run into that could shape what the outcome might be for your infant. And that goes with the long-term healthcare challenges that we've seen. Many times, having the affordable health insurance like Anton was speaking about, people will not many times seek the prenatal care that they need because they don't have the resources to get them. And then we talk about, the discrimination that some people might get, some groups might get, and being an African American woman, just knowing that I'm 3 to 4 times more likely if I was to go to deliver and give birth. My rate of mortality is higher than a young teenage white woman giving birth. Those are real facts. And so when we go into the health systems to access care, we're already having to address some barriers to that care because of those concerns.
And let me also add to that, and I'll put a more finer point to what Renee is saying. The statistic particularly is a African American woman with a PhD is more likely to have a worse birth outcome than a white woman who dropped out of high school. And this really speaks to the structural and systemic challenges with race and racism in the American healthcare system. So this is not just unique to Charleston or unique to the Tri-County region or unique to South Carolina. This is a national problem. And I've kind of lived that experience. My daughter's 15 now, and thankfully she's healthy. But when my wife was pregnant and she went into labor early on Christmas Day, 4 weeks early, we had a clinician who was not listening to us at all, was not listening to my wife, and was really dismissive of our perspective and experience and what we had been dealing with the entire time she was carrying this baby. And unfortunately, this provider wasn't our normal provider because my wife went into labor on Christmas Day. All of her traditional OBGYNs were out of town on vacation. So this was an OBGYN who was at the hospital filling in for them. And so we were trying to explain previous conversations that we had with our previous physicians, and she was not at all interested in listening and was making decisions about how she was going to deliver our daughter without taking what my wife said and what we were concerned about into consideration. And so this dismissiveness speaks to the implicit bias that some providers and some healthcare organizations have about their understanding about people and what people's wishes are in healthcare. So we cannot gloss over this. And I think, when we, see what's happening, not only with COVID, but what happened in the wake of the death of George Floyd, Breonna Taylor, and Ahmaud Arbery, that these contexts around race filter also into how we manage and treat and deliver care. And there's more than 50 plus years of research on healthcare from the Institute of Medicine that documents these disparities in treatment and the outcomes. And so the birth outcomes are just an example of that. It also is tied back to access. Like Renee said, I can tell you from MUSC's growth plan that we're now in counties doing work that we hadn't been previously, that in Williamsburg County, South Carolina, there is no OBGYN in the county. So if you're pregnant in that county, you have to leave the county to go find an OBGYN. And so how many people who may have transportation issues in a rural, underserved county like Williamsburg will struggle to have access? Well, those same challenges are also here in Charleston County, Berkeley County, and Dorchester County. So we really have to dive deep to understand these issues first, what creates them, and understand that we're not going to be able to undo them overnight, but it's an imperative, a moral and business imperative that we find a way to deal with them as quickly as possible, and all hands on deck as we approach them.
Is there a solution, especially given your experience yourself with your daughter? Is there a solution? Is there something we can put into place now? Is there something that we can do specifically?
Yeah, my answer would be to that question is twofold. Yes, there are solutions. So there's not going to be one silver bullet or one thing that we do today that transform things. But I will tell you, access to care will help. A second context would be to raise the reimbursement rates for OBGYN providers, because I have a good friend, Oscar Lovelace, who ran for governor many, many years ago, who talks about in Newberry, where he lives, it's just, it's hard for a physician to practice when, a service may cost them $100 to do, but yet they're only getting $20 in reimbursement. So that's a part two of it. But again, I think the broader scope and scale is how we train and educate our clinicians and our physicians and what they know from a cultural understanding standpoint about the difference in patients and what important difference makes. But I'll leave you with this last point on this one. Albert Einstein was famous for a lot of things. We all know he's probably one of the smartest people to come to the United States of America and added so much value to our country. And I got a chance to do some reading and research in Las Cruces, New Mexico about the nuclear bomb and all of these physicists, very, very smart people who were basically trying to pick Albert Einstein's brain for how they could solve the problem of how we could split the atom in order to be able to create an atom bomb. And Albert Einstein said this: see, the problem with you Americans is that you spend 5 minutes studying the problem, or 5% of the time studying the problem, and 95% of the time trying to come up with the solution. And his approach is to spend 95% of his time trying to understand the problem, and then 5 minutes focus on the solution. And the reason why I give you that as an answer is because these problems are complex. Healthcare delivery and outcomes are complex. And we have to have not only the people in healthcare, like the three that you have on this panel, but every business leader has to think about this the way they think about challenges in their business. How can we come up with a solution that when we implement that solution, it doesn't lead to greater unintended consequences and poor outcomes? So I would say access to care is, everything we have in the Healthy Tri-County, if we just focus on solving those, that would improve outcomes for a lot of people. Because again, nutrition is connected to access. And so my wife is pregnant, how does she get the right fresh fruits and vegetables and enough vitamin D and enough folic acid and all those things so our daughter can be born healthy? But also, how can she get to an OBGYN? So we given a plan, this Healthy Tri-County assessment, as well as the T-CHIP plan, the Tri-County Health Improvement Plan, are roadmaps for how we get to solutions. But again, we also have to be more aggressive and have all hands on deck understanding the problem.
And this is why, thank you, Anton. Looking back to our plan, this is where I believe we were sort of prophetic in the way we've been talking about this for years, looking at those 5 priority issues through the lens of race equity and social determinants. How does education, poverty, the environment play into and affect those issues? We've been trying to address that. And I think part of the solution is simply in our current day now, and maybe a new world we're in now, of listening to each other better. As Anton said, just ask people, how are you feeling? What is your experience? And then get ready to listen, because everyone has very deep experiences growing up in this culture. And so I think that's a big part of it, is simply listening better to each other with respect and dignity.
All right. Okay, great conversation. We're going to take a quick break, catch our breaths, and hear from a couple of more sponsors, and we will be right back with the second part.
With one of the largest networks in the country, and a network of data centers, routes, and multiple points of presence, Comcast can deliver fast speeds and performance. To provide secure connections to the cloud, Comcast Business can connect you to over 600 data centers, as well as multiple major public cloud on-ramps across the country, which serve the Comcast footprint. In today's world, if you can't connect, you can't do business. Do both. Find out more at comcastbusiness.com/Ethernet Solutions.
I'm Barry Whalen, president of HLA Incorporated. HLA just celebrated 34 years in business and is experienced in civil engineering, surveying, wetland permitting, landscape architecture, and permit coordination. These professional skills are used in a unique combination that produces high-quality services and resourceful solutions for site construction projects. For example, most undeveloped land in the Tri-County has wetlands, grand trees, drainage issues, or zoning deficiencies that make it hard to get site construction approvals or create a higher value development. HLA has a talented combination of experienced professionals that get the most out of your site design by integrating progressive land planning with wetland permitting and smart drainage solutions, producing superior results. Experience matters, and we have it because we are the site experts.
All right, welcome back to our live stream event talking about the Healthy Tri-County Initiative. Before we get to our next set of questions, let's cue our second data clip to talk about some of the social determinants. looking at economic stability, neighborhood, healthcare, education, community context, how do these social determinants in the report intersect? Why these? Why are these things important?
Yeah, so social determinants are the environments that we, like I said at the top of the first part of the session, is where we live, work, and play. So our health, it depends on what are we doing at home, what are things are we practicing at home, but also our economic stability, so our employment rates. And all these other factors, they intersect because they impact our health and wellness and well-being. And like we talked about with the food deserts, the neighborhoods and the environments that we live in. Do we have access to public recreation and facilities? So each point of that you see there on that model with social determinants of health have an impact on our health. They intersect. Access is within each one of them as well. And so they are very important to someone's health and their health outcomes. And so through the work that we've done through Healthy Tri-County, focusing on social determinants, we then can take the health equity and the actions and to put them into the social determinants. So we have action behind the social determinants and the disparities that we see. We then can try to take a stab at addressing those health inequities that we might see in our communities through those social determinant factors.
Help me understand what health equity means.
So health equity, it's different than what people would say would be health equality. You know, that's everybody having the same access, everybody having the same footing. But when we talk about someone that lives in the rural community up Highway 17 in Ondar or McCullochville area, and they have those barriers to transportation, that's different than someone who might be their next door neighbor and have all the means that they need to get access to care. So that individual, very much being that next door neighbor, their socioeconomic status is different, their barriers might be different. And so how do we allow someone who might not be as fortunate as the next neighbor to get the equity they need, the same standing that they need to get care and to access care? And so when you think about for access, when it talks about health coverage, as Anton spoke about before, having affordable health coverage. Those of us that are employed, we have our employer programs where we can have health coverage. But what about those who have other issues that they can't work? They have not been able to access all those benefits that might be available to them. How do we help them know what is available to them? How do we help them get connected to those resources? That's some of those equity challenges that we might see in our community, and we have to build those into our health plan. And so when you look at the Tri-County Health Improvement Plan, the response for equity is built into that. If there's an issue with mothers getting access to prenatal care, well, how do we build that into the programming? I know Roper St. Francis on Johns Island has been able to develop a program to bring prenatal care to that community. That's a rural community where access to prenatal services is an issue. So knowing that, one, through data, we have assessed that that's a need in that community and that market, and bringing the resources in to be able to allow those individuals in that community to have the same access to those services for them to have better health outcomes as well. Mark, any additive to that?
No, just one of the major things I've learned is that education is the key to better equity and equality, and justice is really the whole educational. So it crosses over into that if someone better education, you know better, you're going to do better socioeconomic opportunities. It's just one of the main things that research has shown. So again, our support, this collaborative of over 60 different nonprofit agencies all working together in collective impact, one of which being the Cradle to Career, focusing on early education.
Right.
If a child can't learn to read by third grade, they never quite catch up. We need to put more focus on that early education reading levels by second, third grade, and that's going to have long-term impacts on everything in society. So it all connects that way.
So, looking at the Healthy Tri-County report, there's a lot of action items in there, a lot of voices from the community. Does the pandemic help us accelerate some of those steps?
Those steps, yeah, they have been accelerated. When you think about your access to care and your the behavioral health component of that, With the pandemic, access to care was an issue. We talk about people being hesitant to go in to get care at this point, but some of the practices that Roper St. Francis and MUSC, and even with our partnership with the Federal Qualified Health Centers as well, they have pivoted and went to mobile testing drive-through. That accelerated a need, and these health systems have been very innovative about how to bring that unmet need, how to bring a solution to the community. So no, we may not be able to have you come out and get tested, but let's take the resources, whether they're coming from the federal government, they're coming through the state, take those resources and make sure that they're equitable in the communities that have the greatest need. So you will see, that recently there's been, through Federal Healthcare Network, they've had mobile testing in Moncks Corner, in Berkeley County. They have now spread to Dorchester, Charleston, and into Colleton County, because those are communities, and those rural communities, through their partnerships and collaboration, they've been responsive to make sure that testing is equitable in those communities where, one, the corona virus has great implications on health outcomes. To the communities of our African American communities, our Latinx communities, making sure that we know those are targeted areas, they have the greatest need, they have the greatest risk as well, and making sure that those models are put into those communities to provide testing to individuals. I know, Anton, when we first got together, a big part of Healthy Tri-County was our communication between the health systems and our networks. And the first thing I got from both you and Mark were, these are our mobile testing sites, this is what we're doing, but also for those with language barriers, you guys addressing that concern at the top of the pandemic and making sure that we're communicating that if you're having issues getting through due to your lack of access to internet access, your lack of access with health literacy and health education, as Mark talked about previously, that you were very intentional about making sure that this is the targeted population that we're focusing on. So if you wanted to add to that, Anton, with some of the work that I know MUSC had spearheaded.
Yeah, so that's a great segue to why we all have to be responsive on this, is because COVID-19 has put a bright light on the challenges around health outcomes for everyone. So MUSC in particular, we accelerated in a couple ways. So everybody knows that when COVID started, that the governor says if you think you may have COVID and you want to get screened, you can go to musc.care. Even though Roper, St. Francis, a lot of other organizations have telehealth options as well. Just think about people in our communities who live in a rural part of the county where they don't have broadband service, where they don't have reliable internet at all, or even if they do have reliable internet, they don't have a smartphone and they got a flip phone. Or if they have a smartphone, maybe they don't know how to use it in a smart way. So they can't navigate a virtual urgent care website on their phone. So what do these people do if they have symptoms of COVID and they're being told on the news to stay home or stay safe or social distance, and maybe they don't have transportation to go to anywhere anyway? That's why we responded with a old-fashioned phone line, a hotline, if you will, that you could call if you don't know how to use technology, and we can do the virtual urgent care screen telephonically over the phone and get a clinician to call you back. And if you need testing or screening, then give you a pathway in order to be able to get tested or screened. And we made that phone line available in English and in Spanish. We also went to our local homeless shelters and people who are unhoused in our communities, because it's very hard to social distance if you don't have a home to social distance in. And so you have a lot of people who are in public shelters and others who may be symptomatic of COVID. And so how do we not allow that to become a situation where it becomes a hotspot? So an old-fashioned hotline where people can call was one of the options. The second option is that we asked the state to be a partner with them to help make sure a lot of rural communities get tested. And we have literally been able to go into communities, very small communities all around the state of South Carolina, who never had a presence from a hospital in those communities, or much less a federally qualified health center. And not all of them, because FQHCs are in a lot of great places around the state. But we've gone to some places in very, very, very small communities and tested 400 or 500 people who otherwise would not have been tested. And of course, that first round, the positive rate was very low, so about 2 or 3%. But now in almost every place that we're testing, we're at around 13 or 14%, in some places 15%. So it's critical that we get people tested, but that's only part of it, because as we go back to social determinants of health, if I lived in a 3-bedroom double wide with 5 other people and I test positive for COVID, how can I really social distance in a space like that? And how can I keep myself healthy in that process, but make importantly that I don't get everybody else in my household sick? So we think about housing as a social determinant of health, and where people live and what's the quality of their housing. So COVID has put a bright light on all of this, and I'm so glad to see how all 3 of our organizations have been responding, and the community broadly have been responding. I want to give big kudos to a lot of our local elected officials who have augmented what MUSC, Roper, and Feder and Trident United Way are already doing. But the fact that Feder was able, with support from the Charleston County, to be able to have like 2 weeks of testing where they tested all over the county in full days, and that we're partnering with them to run operations jointly. I mean, there's so much collaboration happening that I think this is going to be a good opportunity for us to assess these challenges. But I want us to make sure that we don't go backwards, that when COVID subsides and we think that the crisis is behind us, that we don't go back to sleep how we were before, or go back to the old normal, but we create a new normal of collaboration, of engagement, and particularly creating more equitable access in rural underserved areas who have the highest need.
I want to use the last few minutes to talk about success. What does success look like for addressing some of these intertwined, overlapping health and economic issues? And I know that's a giant question, but Renee, I'd like to start with you. What does success look like?
And speaking from the Healthy Tri-County with all our partners here today, it is about the things that you saw on that second video clip, the collaboration, coming together to make sure that we're informed. But that collaboration has to make sure that the community voice is there as well, right? And then joining efforts like Healthy Tri-County, coming into the fold of this work, even if you are from different sectors that traditionally you don't think impact health. We just talked about how health is across all environments and all sectors. So we invite the business community in to have a seat at the table in that collaborative spirit. And then we think about our action to spread the awareness. So now today, you know about Healthy Tri-County, you know Roper St. Francis, MUSC, and all the partners in our network of this initiative are at the table having these conversations. Spread the awareness about that. We know that you can see that we've identified what those 5 priorities were, that were informed by the community of what those needs are. And so then that is the impact. Help us move toward the impact, addressing the health equity concerns that we see, the social determinant factors that we see, and have a seat at the table and become a part of the solution. And make sure that the community is engaged in that. Because what we learned at the top of our 2016 Community Health Needs Assessment is that we wanted to be sure that we heard from the community and that they had a voice at the table. Because we have an idea from just our conversation today of what some of those needs might be, but
Right.
The community might say, my need is not about getting a doctor.
That is true.
My need is about, do I have healthy foods at home right now? And then being responsive and coming back. And so Anton led a group at that point that said, well, we hear that we tell you what's happening, but we want to make sure that you come back. And so I think what we're seeing right now, what success looks like is we heard the community. We are being intentional about going back out and making sure we're addressing those issues that they talked about, and using the data to inform how we move forward and to gauge what success looks like, and having these kind of virtual sessions and pivoting and letting them know that we're still out here, we're still communicating, we're still coordinating for greater outcomes, and for them to adhere to what is being given through the guidance from the CDC, from SCDHEC, from each of our individual institutions as well, and that they're responsive. And so what we will see is that those measures, the same way we saw a kind of flattening of the curve, now we're seeing that spike again.
Yes, we are.
That we adhere to the policies and the programming that has been put in place by many of the professionals who can help us, stem the tide of this pandemic.
Mark,
Success will be a healthier community for every individual and family in our area. And these are all measurable kinds of things that we look at. knowing that we're speaking to the business community, our hearts go out to you because it's not just the economics. You're providing jobs for people to help their families be secure and thrive into the future. And so we really commend you in the business community. We are here for you. In that regard, our occupational health department is ready to help in many different ways, from testing to support, education, the PPE equipment, individualized safety plans for businesses. Please just contact our Return to Work link on our Roper St. Francis website. There's a phone number, people ready to help you in that regard. And again, immediately to wear a mask. We're all wearing masks here in the studio. We just took these off to speak now for this program. But again, we need this as a collective effort throughout the community as one of the major ways to prevent the spread of the virus and then thrive into the future, and we'll be healthier and better off long term.
Anton.
Yes, very briefly, Renee gave the greatest answer that we could have on this. We all have to work together on this and to make sure that we understand that health is wealth and that we all have a right to be healthy and should be healthy. And then we have to have a community-wide, multi-dimensional solution to it. And that requires the business community. The business community can play an important role. We've seen how the business community has stepped up to help us to respond to the coronavirus, but that's just a short-term response to an immediate crisis. But how does the business community stay a partner long-term to make sure that we all work together to make health a priority for us so we can get the best out of all of us? And we know a strong, productive employee is a healthy employee. And that means we all got to be partners in this together. So I think that's what success looks like, is when we all decide to form like Voltron and make this happen. And I think that's what we can do.
And if you want more information about this, and I would urge you to go to the Healthy Tri-County website. It's healthytricounty.com. The information there is organized in such a way that you will spend way more time than you realize, because it's very well organized. It's very quick and easy to absorb, and you'll hear a lot of the voices and see a lot of the points that you'll want to probe into. So healthytricounty.com. If you can't find it, contact me. We're going to put it on our website as well. Thank you, all three of you, for joining us today, and thank you to our audience. We're going to be back in July, on July 16th, with a mayoral forum. We're going to safely distance all of the mayors from our region, and thank you very much, and we will see you then.